Next question is from EFE News Agency. We have Antonio. Antonio, can you hear us?
Good afternoon.
Good afternoon.
Yes. Thank you for taking my question. So the main accusations of the US president to WHO are that the organization failed to confirm in the first weeks of January that there was human-to-human transmission, and also that it opposed flight restrictions from China to US and other countries. What has WHO to say in its defense?
We'll be, as the DG said, we'll be examining all of the actions taken by everybody in this. So in that sense, the idea of having a defence at this point seems rather strange. In the first weeks of January, WHO was very, very clear. We alerted the world on January the 5th. Systems around the world, including the US, began to activate their incident management systems on January the 6th. And through the next number of weeks, we've produced multiple updates to countries, including briefing multiple governments, multiple scientists around the world on the developing situation. And that is what it was, a developing situation. The virus was identified on January the 7th. The sequences were shared, I think, on the 12th with the world. We're dealing with a completely new virus. All potential respiratory pathogens in the initial reports, in which there were no mention of human-to-human transmission, it was clusters of a cluster of atypical pneumonia or pneumonia of unknown origin. There are literally millions and millions of cases of atypical pneumonia around the world every year, and in the middle of an influenza season, sometimes it's very difficult to pick out a signal of a cluster of cases. In fact, it's quite remarkable that such a cluster was picked out, 41 confirmed cases ultimately in a cluster in Wuhan. There is always a risk with respiratory pathogen that it can move from person to person. We've seen with MERS, for example, can spread from person to person, but in very particular environments, as we've seen, in an occupational environment, in healthcare environments. And when WHO issued its first guidance to countries, it was extremely clear that respiratory precautions should be taken in dealing with patients with this disease, that labs needed to be careful in terms of their precautions in taking samples, because there was a risk that the disease could spread from person to person in those environments. There is a difference between the potential for human-to-human transmission. For example, avian influenza H5N1 can spread from person to person, but it doesn't spread efficiently in community settings. It can spread in specific settings, like a family, occupational or healthcare environment, but it doesn't tend to spread at community level. The determination was not whether or not human-to-human transmission was occurring. The determination was the virus spreading efficiently at community level outside those environments. And that is not an easy determination to make, and one has to make that very carefully. So from that perspective, and we'll be very happy when the after-action reviews come. In fact, I am very anxious for those after-action reviews to come, because we do them for every outbreak response, and I'll be delighted with our teams and look forward to that engagement, to look and see where we can learn to do better, where we can improve our response. With regards to flight restrictions, and I've certainly been on the record on a number of occasions saying that the implication or the imposition of flight restrictions by countries is the sovereign right of any member state. WHO does not control the law on this. WHO's only function under the IHR is to challenge member states who put in place restrictions to ensure that they have a public health justification for imposing those restrictions, and that we are bound then to share those justifications with other countries who may be affected by those flight restrictions. That is the role of WHO, to ensure that restrictions on flights are public health-based, evidence-based, limited to controlling the disease, have a balanced impact on travel and trade, and are short-lived and only of a duration to control the public health event of concern. So that's the framework. The International Health Regulations is a framework negotiated by 194 countries. We simply implement that framework on behalf of our member states.
So just to add to that, so exactly as Mike said, you know, what in the beginning of an outbreak, I actually went back and listened to my press conference on the 14th of January because it was a significant event for me. It was my first press conference I've ever done. But in terms of the outbreak itself, I laid out what are the things we need to know. And at the time, there were 41 confirmed cases. And Tarek was with me at that press conference. And what I outlined were 6 things. I outlined, you know, what is the pathogen? How do we identify what this is? And at the time, we had learned that it was a novel coronavirus, and that sequence was shared, that the pathogen was identified. It hadn't been shared yet, or I'm sorry, it was shared on the 12th of January. We needed to know the source of the outbreak. How were people getting infected, including a possible animal source? Because all of our experience with other coronaviruses and emerging respiratory pathogens, most of those come from an animal source. We call those a zoonotic spillover event. We needed to know what disease it causes and how to care for people. We need to know the modes of transmission, including if there is any human-to-human transmission, what is the extent of transmission. We needed to know how to limit exposure and what to do, what is the extent of infection. And so all of our guidance that was out before we did that press conference was about limiting exposure to people and to prevent transmission, particularly in healthcare settings, because all of our experience with SARS and with MERS showed that those viruses could have explosive transmission and amplification in healthcare facilities. And so we wanted to ensure that frontline workers were protected. And so our guidance that was put out was about respiratory droplets and contact protection. And so all of that was out on the 10th and the 11th of January.